Uh, Okay, I think I'm back. Hello, everyone. Welcome to the September Public Health Modernization Chat. I hope you're in the right place. I think most of you are. My name's Heather Redmond. I use she, her pronouns, and I'm the Strategic Initiatives Partnerships Coordinator in the Public Health Division. I'm here with a few other Public Health Division staff. I don't know if Sarah or Kayla, you would like to introduce yourself, or I can just say, hey, you're here. Totally your call. You can wave. Awesome. Um, that was Where You Lead by Carole King. For me, that song I associate with the hit show Gilmore Girls. September is usually what they call Gilmore Girl kickoff season. A lot of people rewatch the show in the fall. So, if you all could do me a favor, when you introduce yourselves in the chat, I want to use that as motivation for our question today. As we have a few more weeks left of summer, but a lot of people feel like this is the time to embrace the transition of the seasons. What makes you think of fall, or what do you do to get ready for the fall season? So absolutely, same as usual in the chat, name, where are you coming to this meeting from, pronouns if you wish to share, and what's fall for you would be great. So if you can just fill that in. And yes, I see a couple comments of shout out for Carole King and shout out for Gilmore Girls. So that's very fun. Um, let's see, what is next? We're going to go ahead and just get started. We have Jen Chandler with us here today as our presenter. I hope that most of you were able to get the reminder email that we're going to be talking about tobacco prevention. And there's a report with some really cool stuff that Jen is going to teach us all about. So Jen, if you are ready, while folks are still introducing themselves in the chat, if you could introduce yourself and take it away.
Sounds good. I am going to share my screen here and make sure you get the correct view. There we go. Hi. Um, so yeah, I'm here today to talk about our 2023-2025 Tobacco Prevention and Education Program Report. We've titled it Empowering Communities to Drive Tobacco Prevention Efforts. My name is Jen Chandler, as Heather noted. I am the Policy and Programs Manager in our Health Promotion and Chronic Disease Prevention section of the Public Health Division. This is a legislative report that we do provide to the legislature every biennium to provide to provide funding and program progress updates. There we go. So in our time together today, I'll provide a brief overview of the Tobacco Prevention and Education Program. You'll probably hear me refer to it as TPEP quite a bit. Um, the TPEP funding and allocations for this is reflective of the 2023-2025. So it's a reflective report. I'll provide a short overview of the comprehensive tobacco control model. I have some TPEP program highlights, and then I've left, I think, quite a bit of time at the end so we can have some discussion, or I definitely can answer questions at the end. But if you would like to put questions in the chat, Heather can let me know that they're there, and we can answer them in real time. Onward. So the Oregon Tobacco Program supports statewide tobacco prevention and quit or cessation programs. When we talk about tobacco today, we're really talking about products that include cigarettes, cigars, chewing tobacco, and electronic cigarettes. TPIP is funded by tobacco tax dollar revenue. The tax was increased through ballot measure 108 and went into effect on January 1st, 2021. 10% of the revenue from tax dollars is used to provide funding for state prevention infrastructure and for local grants. The other 90% is allocated to Medicaid. Through TPIP, we fund and collaborate with local public health authorities, which I will likely refer to as LPHAs at some point, our tribal partners, community-based organizations or CBOs, and regional health equity coalitions, uh, also known as RHECs. So why tobacco prevention? I know I've heard folks say things like, nobody really smokes anymore. And I also recognize that we're constantly in an environment of competing priorities, such as addressing illicit drug use. But tobacco and other nicotine product use still affects many people and is the leading cause of death in Oregon and nationally. This slide has a few statistics that illustrate youth use, adult use, effects on health, and some economic impacts related to healthcare and productivity in the workplace. I will be able to provide the slides, make the slides available if that's helpful. And all of this information is also in the report, which is pretty extensive. And it's in the link that I believe Heather is going to drop that goes directly to the report. So TPEP is based on a comprehensive approach to tobacco control and prevention as recommended by the CDC. This includes these 5 points here: state and community-led interventions, health communications, support to help people quit, data and accountability, and infrastructure and administration. I'll talk a little bit about how we allocate the funding to support each of these, and then we'll share some examples of how these components show up in our tobacco prevention efforts. I'm not going to talk too much about data and accountability specifically, or infrastructure and administration. One, because I'm not the expert in data, and two, the infrastructure administration and management is not that exciting. But we will talk quite about the other three components. So what you're looking at here is an illustration of what the CDC recommends we allocate for tobacco prevention programs. On the left is what Oregon based their 23-25 tobacco control budget on. You'll see two pretty big distinctions that might stand out. One of those is the fact that we invest quite a bit more in our state and community programs than the CDC recommends. But at the state level, we do invest quite a bit less on cessation services. Now, I think it's important to note, though, that a lot of the funding that goes to local programs is used for cessation services. And we find that that's really important because those services can be tailored to communities that are experiencing more disparity from tobacco use. Local programs know their local communities. So why did we do this shift to more funding for local programs? Well, we know that the tobacco industry has disproportionately marketed to the groups listed here for decades now. We know that prevention and cessation efforts are more effective when communities use local data and community engagement to determine their community's priorities and can invest in population-specific prevention interventions and cessation services. Now I'm going to share some examples of how the program comes to life. One way we are able to invest in both state and community interventions is through strategic communications. And with strategic communications, we're able to drive policy change. We can provide quit supports and resources to access quit services. And then we also are able to raise public awareness and provide education. OHA manages a brand called Smoke Free Oregon. And in April of 2024, we launched a statewide campaign called Imagine Oregon Without Big Tobacco. Imagine includes calls to action, such as activities like local civic engagement or supporting loved ones to quit and stay quit. I do have a video that we can play. I'm gonna stop sharing and Heather's gonna pick it up and play a video of one of our ads.
All right, let's see how fast I can do this. I'm pretty fast, but sometimes. Share sound. Let's do it.
Imagine Oregon without big tobacco, without the harm it does to our communities, to our air and water, to the people we love. Imagine how much more we could do. Having fun, sharing real connections, expressing ourselves, doing the things we love with the people we love. There's a healthier Oregon ahead for all of us, working together and doing what we can on our own. We can protect communities from big tobacco. Let's do more than imagine it. Let's create it together.
Apologies for the
there's
lack
a way
of
to drink
closed
ice cold
captions. I'll
water
grab
that
it
can
next
melt
time.
away the
Okay, I think I'm back. Yeah, so we do have three different concepts. This one is to reflect more of a, I guess, an urban vibe. We have one that really is reflective of our rural and frontier communities. And then we have another one that's very uh, reflective of the natural aspects of our state, including, and it includes Sasquatch if you haven't seen it before. Uh, um, the fun fact, oops, sorry. We do evaluate all of these campaigns. We do both pre and post surveys and campaign analytics. The pre and post surveys are able to help us understand if people are aware of the campaign and that it kind of stuck with them. We can also ask questions about behavior change. So we get quite a bit of information from people in Oregon that way. And then we use campaign analytics to make sure that our campaign is working. Throughout the campaign, we can see things like website hits and social media shares and did folks sign up for a newsletter? And that helps us understand what our reach is once the campaign is complete. This particular campaign was unique in that this is the first time that we have engaged partners from day one. We always do focus groups and other engagement to understand how to build the campaign that will be effective. But these partners started before there was even a concept and informed the campaign development all along the way. And they stayed all the way through, informed the evaluation, participated in the evaluation, and really were invested in helping us understand that this campaign, if this campaign was working and what we could do better. One fun thing to know, all of the artwork for the campaign was created by people from Oregon. You can see all of the artwork that was created for this campaign and find resources at the link that I believe Heather has or is going to drop in the chat. Thank you, Heather. Okay. So now I'm going to talk a little bit about our local programs. And I'm going to start here with tribal tobacco prevention programs. So a portion of the tobacco tax dollar that is allocated to our tribal prevention program, housed in OHA's Behavioral Health Division. These are some examples here of tribal best practices or other culturally relevant investments. Seed to ceremony, sacred tobacco and traditional medicine gatherings, providing culturally relevant quit supports, updating policies to address vaping. For example, some properties might be smoke-free, but they don't indicate that vaping is included in that. So they're clarifying those policies and updating them. And then requiring program coordinators to have credentials as certified prevention specialists really helps to keep the field consistent. And we found it to be pretty helpful. Okay. So the key to the momentum behind the state's tobacco reduction efforts has been the development of collaborative efforts with community partners to further reduce tobacco-related harm and promote health equity across the state. We currently fund 94 grantees through the Public Health Equity Program. These organizations focus primarily on culturally and linguistically relevant prevention efforts, and they provide cessation supports as well. The types of programs that are being implemented are innovative and exciting and extremely diverse. So we're looking forward to seeing what comes next. Their work addresses social and environmental influences on tobacco use, which you also may recognize as social determinants of health, or the way that we work towards addressing those is through upstream efforts. One such partner, Ant Farm, which is a community-based organization in rural Clackamas County, has a robust mentorship program, to help youth quit tobacco. They do this by creating spaces and projects that give youth a sense of belonging. I have yet another video for you to highlight some of the exciting work this organization is doing. I will stop sharing. Back to you, Heather.
Amazing. And thank you all for your patience with our screen shares. We have a very dynamic presentation today. So hopefully the captions will show up on this one. And here we go.
I started vaping during my freshman year. I'd gone to the bathroom. Some kids approached me and they were like, "Hey, do you want to try this? Like, it's a vape." And I was just like, I'm sorry, what? I kind of gave in to everyone being like, "Here, try this, try this, try this." And it was something that I got stuck on. It was like, I'm quitting, but then everyone would be like, it's a new flavor, just try it. I knew it was bad for me, but it was just how I coped. And so I kept doing it and kept doing it. I couldn't imagine like someone approaching my sister the way they did me and then her giving into it at her age. Like, I want better for her. The more time I spent with my mom, the more afraid I got of disappointing her, and I was just using it less and less until the point where I was like, I don't need this. This isn't good for me. I should quit, and I did.
There you go. Okay, I'm back. I think at the end of that video, it sounds like she said that she didn't quit, but she did. I think it's something in the audio, but we did a number of these videos with different community partners, and they turned out really well, and they've been really well received, and we've seen some great examples of partners being able to use these videos as a tool for um, community engagement and outreach and education. So it was a great investment of our TPEP dollars. So regional health equity coalitions, or RHECs, provide culturally specific supports and advocacy for groups of people living in Oregon who have not historically benefited from mainstream approaches to public health. RHECs are critical partners for us. Our work, our public health agencies, to ensure these voices are represented. This is particularly important with OHA's strategic goal of eliminating health disparities by 2030. By partnering with RHECs, the Health Promotion Chronic Disease Prevention section gains critical access to needed partners when advancing health equity. We provide stable funding to support the core work of RHECs across the state. We believe that all the culturally specific work done by RHECs is part of our tobacco prevention and cessation efforts. Our RHECs target known drivers of tobacco use, such as structural oppression, cultural isolation, culturally and linguistically accessible healthcare and services, and community civic engagement. And lastly, but definitely not least, our county TPEP programs. These programs are administered by local public health and serve all Oregon counties. The primary focus is on policy systems and environmental change approaches to public health prevention. You may hear this referred to as PSC from time to time. Programs engage in community and partner engagement to make data-driven decisions about their community priorities. County programs leverage statewide campaign materials or create campaigns that better meet the needs of populations experiencing disproportionate health inequities in their region. They work to identify opportunities to move local retail policies, support smoke-free spaces, and implement cessation supports. We have another highlight here. This is one that is both local and state. So we do believe that it is essential to address flavored tobacco. As you can see, of the flavored tobacco and vape product users, young people are substantially more likely to use these products. We are fortunate that in 2001, the Oregon State Legislature created the Tobacco Retail Licensing Program to ensure businesses follow tobacco sales laws. Since the program began, illegal sales to underage people have consistently gone down from 26% in 2002 to 14% in 2024. This helps limit access to tobacco and other nicotine products, including flavored tobacco and vaping products. We do not currently have regulations in place to address the increasing availability of synthetic nicotine products, unfortunately, but it's something we're working on. The good news is TPEP works. Our per capita cigarette sales have been steadily decreasing over time and continue to do so due to local efforts to meet the needs of their community and proven statewide policy interventions, such as the passage of the Tobacco Retail License Program, limiting sales to those over the age of 21, and increasing the tobacco tax. So now I think I talked too fast. I have questions. These were just some prompt questions I was thinking about when thinking about folks who may be here today. We definitely don't have to stick to this. It's not a script, but I am happy to engage in conversation around any of these. Or if there are other questions that come up, we can do that too.
I'm going to do my best to copy the questions into the chat. But yeah, these are awesome, Jen. And I'm wondering if anyone here, whether they're already connected to work around tobacco in their communities or from all the information you shared, um, also might have some reflections that or some thoughts that have come to them that they might want to share as well. So in the chat or please feel free to raise your hand. I'll mute myself and give you a little bit of time to process and think. And then if you have thoughts or answers to these questions or your own questions, please let us know.
I'm happy to go back to any slides if folks wanted to spend. I kept it pretty high level, so if there's anything you'd like a little bit more information about, if I can answer it, I'm happy to, or I can take it back and follow up.
Looks like you have a comment in the chat from Sean who says, we are teaching vape prevention to fifth graders because once they hit middle school, sometimes it can be harder to reach them. We also want to work with schools to initiate policies about youth smoking and vaping on campus that would use diversion education. Getting suspended doesn't work. Kids think it's a holiday. We also want to work with our medical community to look at smoking cessation for youth because so many products are geared to adults 21 plus.
That is a great reflection. Sean, are you willing to share with how where you are working on this? Is a school or local public health or community organization? I think one of the things that's been really vital or really important to our local programs is this alternative to suspension model. Um, and so if you are not yet connected with your local public health authority and their tobacco prevention program, you might reach out. I'm happy to make the connection. At the end, I will put my contact information in. Um, and yeah, I think to the first part of your comment, um, there there are developing approaches to youth prevention and cessation, particularly as it relates to vaping. And there's definitely a gap, but it is like feverishly working to get more resources available. So hopefully you can catch them before that they enter middle school. And if unfortunately they do start using tobacco products, we're working really hard to get quit services set up for them.
Awesome. I see that there's a hand up. And just for your information, Jen, Sean says that their mic isn't working, so they apologize that they can't they can't answer.
Well,
But
that's okay.
they work with Mercy Foundation.
Okay,
So
great.
all right. And then who is on the phone that has their hand up? I don't know if others can hear them. I cannot hear them. Oh, Michelle, were you also on the phone? Okay.
Sorry,
Go for it.
failing at tech today. Was trying to join on Zoom, but yes, been listening on the phone. So thank you for your patience. Hi, everyone. I'm Michelle Glass, she, her. I work with the Southern Oregon Regional Health Equity Coalition, and it's great to be able to see your questions, Jen. I was like, I wonder what the questions are. Um, One of the reflections that I've been thinking about a lot and we've been talking about locally is how good it feels to recognize all of the capacity that has been built across the state with these dollars in the first two rounds of the health equity grant that now mean that more people are connected to supportive communities, resources, culturally relevant spaces, and connections at a time where we're seeing stress skyrocket and the social determinants of health really impacted by federal changes. And so we're flooded, right? We have community members and partners coming to us asking questions about SNAP changes and Oregon Health Plan changes and job changes and funding loss and all these things. And a lot of those connections and spaces were built with these dollars. And so I think thinking about upstream investments, we are always investing in relationships first and building community capacity so that we are a place where people can come when stressors are triggered. And I think that that's a really important protective factor. And I know that that's the case across the state. And I'm just really grateful that the state was willing and saw this years ago, like we need to invest before the next crisis. We had just gone through COVID. And I think we're seeing another similar moment of disruption in a lot of ways that's impacting people. And I just really want to applaud the state's deep investment in primary prevention strategies that include upstream interventions and culturally specific supports that I think really matter in this moment. So thank you.
Thank you for sharing that, Michelle. Well, in the increase in the tobacco tax, there was a lot of involvement from the RHEC programs. So um, it's that kind of advocacy from partners that really did do the work that needed to be done to pass ballot measure 108. It was quite widespread and impressive. I did see, I think there was, oh, no, that you were putting that in the chat, Heather. I thought somebody was asking about the surveillance and evaluation resources.
Sarah, do you have a question for the group?
I have a question for Jen, actually. Hi, everyone. I'm Sarah Boudreau, and I'm with Oregon Health Authority in the Public Health Division. And Jen, you were talking a little bit about the work that you do with schools, which of course is like such an important place for younger people. And as an aside, like my son was in 8th grade last year, and I was so impressed with the health curriculum and the strong prevention and sort of like emphasis on practicing your skills to say no. I thought it was great. So within the program, can you talk a little bit more about how schools are involved, or how maybe like CBOs that are doing the work are encouraged or supported to work with schools or school settings?
Mm-hmm. Yeah. I think that alternative to suspension is a big one. We also see a lot of, well, we've heard from our from local public health that there are numerous schools that would be interested in putting in vape detectors. And so we've done some work at the state to try to help support those LPHAs that want to address that issue. We don't really, I mean, there's probably some local programs in County TPEP that do some coordination with schools around education, but that's a little bit distinct. And not that it's not allowed, it's just that I think, the capacity to like provide health education on behalf of the school is pretty limited. Um, but we do have a number of programs, actually in our alcohol and other drug prevention program, that work with schools quite a bit, particularly around vaping as it relates to this presentation. And I do know that there are a number of CBOs that are funded to do commercial tobacco that work with the youth serving organizations, and likely there are some that work with schools as well. I wouldn't have a number for you, but I could get it.
Jen, there's a shout out in the chat. I don't know if you can see it from Michelle, that they really love the integrate it into their local communications strategies. That it allows them to always be in the know about resources that are available and to share them regularly via text message and through their own comms channels. So shout out to programs for this sake of this conversation at OHA that are able to make it easier, more stress-free for people at the local level doing this, connected to this work, to be able to continue to share and spread the message of resources and support. So thanks for sharing again, Michelle.
Yeah.
Um, and then one more
We
comment.
also do tailor materials. They can be requested in different languages. So just a little plug.
Amazing. Yeah, I think Michelle also shared that specifically, Smoke Free Oregon, and then Vive Sin Fumar for Spanish. It's been a while since I've taken a Spanish class. I hope I did not mispronounce those words. And then Sean shared again, both our LPHA and substance abuse organizations have talked about the need for diversion education for kids who vape and smoke. So, yeah.
That's great.
In coming back to some of the questions that Jen shared, I really like the last one. Obviously. What other resources or can we connect you with? How can we, I think the we being Oregon Health Authority, the we being Jen's program specifically.
Yeah,
Um,
yeah.
but yeah, what is it? What do you all feel and think is still needed to be able to continue to work towards a smoke-free Oregon? We know we're making progress, but what else? Yeah, Michelle.
One question I have when it comes to like tailored content or thoughts for moving forward is connecting. Is there a discussion internally about acknowledging the increase in stress for communities in this moment, especially communities most targeted by big tobacco because of the stress that they live under due to, systemic oppression? I think a lot of that is being triggered right now for communities of color, for immigrant communities, for low-income communities, for disability communities.
Mhm.
Um, and I think it's an opportunity to, like, it's a moment where coping mechanisms are going to be more appealing, right? For all of us, we're all trying to figure out how to cope. And so I think it's a moment of risk, of increased risk. And I think there's an opportunity to prompt specifically to say, like, the world to acknowledge what people are experiencing. Like the world is a lot right now. Do you have a strategy? Do you have healthy coping mechanisms ready to go? And like prompt people, right? To be thinking in those ways instead of like, is that already in development? I think that's something we would be really excited to share, like something that speaks to and connects to the lived experience of communities across Oregon in this moment. And gives them something positive to do that is a good prevention strategy and empowering.
Yeah, we definitely have had that conversation. Um, there we recognize that that concern. We also recognize that one of the big responses we got about some feedback we got about Imagine, while a lot of people really loved lots of the different aspects of the campaign, it was very much called out that in our major campaign, we didn't have any um, there were no translations, and I think they got to that decision. It was pre-me, but I think they got to that decision because the campaign wasn't created to speak to like a wide variety of audiences, and so um, kind of did more of the geographic diversity this go around. But it was a big flag by people who provided feedback that the same messages weren't going out in other languages. Now, we did do, I didn't deep dive into this, but we did do 5 mini campaigns to um, help provide some. They did go out into the public, and we did provide some resources to grantees. And there was a version that was created by some partners who are part of different Asian communities, and it was translated into, I think, 5 different languages and when it went out. And then there was one that was more geared towards uh, um, Latino communities, and so that one was put out in English and Spanish. Um, and so we recognize it was a problem. Unfortunately, I think it was a little bit of an after fact, and we absolutely recognize that going forward, that we need to, when we identify communities that are being disproportionately affected by tobacco, that we have to address those first. Um, we we are we specifically we've been um, talking about the need to so Vive Sin Fumar is a cessation campaign, and we don't really have a prevention strategy that meets the needs of that community. And so thinking about what that looks like and how we address communities that are dealing with stress, and what do we need to do from a communications perspective. I can absolutely pass this information on to the comms team too, um, and uh, just help them understand that there may be things that are heated right now that are elevating stress, and that we can suggest that we put out some content that addresses that more specifically.
Yeah, thanks, Jen. And there, I recognize there may be funding constraints or programmatic constraints that we can't see, but I think from a community perspective, Vive Sin Fumar is like established. It's a reliable resource.
Mhm.
It has some like brand visibility, at least for partners. That's where we reach for when we need something that's culturally and linguistically more appropriate and accessible. And so, from our perspective, if that broadened, or if like occasionally there was some like prevention messages that were added to that feed, it would be
Mhm.
really seamless for us to keep sharing. And we do struggle with parity when there's a new English resource and there's not a Spanish version. Sometimes we don't have the capacity to stop and create a translation,
Mhm.
a resource to create that parity. And we try not to share monolingual or mono English resources when we can avoid it. So
Mhm.
if there's a way to broaden that or pepper in
Yeah.
some other resources, we would love it. We would share it. If there's constraints that we can't see that prevent that, totally get that too. But I think instead of setting up a whole new like and here's our prevention arm in Spanish. Like that would be, I think, confusing and feel a little fragmented from our perspective.
Mm-hmm. That's good to know. I think we struggled with that question for a little bit of, is it something different or is it an expansion? So it's nice to hear from you, Michelle, that that would seem like a disconnect since there is so much brand recognition. So appreciate it.
And while Michelle was sharing, I saw at least one other person in the room give a enthusiastic upvote to that. So yeah, there's that too. Yeah, and I just want to recognize too that I know that there's been a lot of acknowledgement and conversation around taking in this really important and critical feedback from folks that are in community, that are community, that are like, here's where the gaps are, and here are the things that would make this work more impactful. And not always being able to see that realized on the other end, especially for us as like a really huge state entity and system, and just continuing the conversation around how systems were never created to do it all. That systems have historically oppressed, have historically excluded, and so having these conversations and having your all willingness to share your wisdom with us and your experiences in your communities with us continue to give us what we need to keep pushing towards getting our programs and our systems to where we want them to be. And so I just also just wanted to pause and recognize that there's always going to be room for improvement. And we, as the people that are, not in charge of the system, but in the system, have the opportunity to take that information and apply it to the jobs that we're showing up to do every day. And we are going to continue to continue to be the people from the inside that are going to want to pivot and change and push to be able to get where we need to be able to close those gaps. And Michelle, I know that you had shared with all of the changes that are coming. Folks are now going to have less reliable access to resources with SNAP and with Medicaid, and just being able to recognize as well that that we still have a job to do. I'm talking we as in the OHA we right now. You all also have really important jobs to do, that we have really important jobs to do the best with what we have when we have it, and to continue to call out when those systems are contributing to those health inequities. And so that was a little more, those were more words than I was intending to say about that, but I just wanted to capture the importance of this collective conversation as well. So
Oh, I'm gonna put my thank you for all of that, Heather. I'm gonna put my email address in the chat because I realized I stopped sharing before I got to um the the email address part. But I do really appreciate you all for being here and um, participating in a conversation about tobacco prevention.
yeah, and I'll just highlight another comment from Sean. Thank you, Sean, for just like really being all in this conversation today. Just to recognize that when people are in a place where they can make the decision to make secession a part of their plan to keep themselves healthy and safe, that recognizing that deserves celebration, that being able to successfully accomplish cessation, to quit, should be celebrated. And so I think that also ties back to what you're talking about with communities that are disproportionately impacted by big tobacco, and all of the parts of ourselves that we bring, that we hold, all of the identities that we have, that the stress, the histories that we hold, how we're doing our best with what we have to manage the lives that we are living. And so being able to do something like quit nicotine when for, we talk about it being a coping mechanism. That yeah, it's a really big deal. I know that I know that I hear a lot of like talk about it in and around, community that I don't think it also gets the celebration that it deserves. So thank you for pointing that out, Sean, as well.
Yeah. And the earlier that somebody starts using nicotine products, the harder it gets to quit.
Mhm.
It's more likely that they will be lifelong nicotine product users. Um, Not everyone. So yes, we should celebrate when they do, but also a good reason to make sure that we're paying attention to what's going on with our younger folks.
Absolutely. And Jen, thank you for putting your email in the chat. I don't see any more questions. And so I'll just go ahead and wrap us up. So thank you, Jen, for coming to share with us today. As folks know, you'll be receiving a follow-up email that will have the slides that Jen shared, links to the websites and resources that were shared in the chat today, as well as Jen's contact information. And we really hope to see you all back here in October when we're going to have folks from WIC, Women, Infants, and Children, come and share about some of the work that they are doing. So with that, please enjoy your Thursday. Please enjoy your first week of September. All of the good vibes to those of you that are having your kiddos start school this week. So another huge shift for a lot of folks in what their home feels like. And yeah, we'll see you again real soon.
Thank you.